Hello, good afternoon. This is Dr. Ram Mohan. I am a consultant pain management specialist at Yashoda Hospital, Secunderabad. Today I'll be answering some frequently asked questions about disc prolapse. The intervertebral disc is a soft rubbery structure which is present between the spinal bones. These spinal bones are called vertebrae. The disc basically has an outer shell which is hard and an internal gelatinous material. You can think of it like a Cadbury's gem, which is hard on the outside and jelly on the inside. The disc provides shock absorption to the spine bones, and it also provides stability to the spine. Behind the disc you have got the spinal canal, through which all the nerves which exit the spinal cord to different parts of the body are present. On either side of the spinal column you have got small holes, on both sides. These are called foramina, through which nerve roots exit the spinal column. And this is commonly where a disc, when it prolapses, it starts to irritate the nerve. There are certain risk factors for the development of disc prolapse. These include obesity, lack of exercise, poor posture, lifting heavy weights, and also old age. When the outer shell of the disc, which we call the annulus, breaks, then the internal material, the nucleus, sort of leaks out between the fibers, and depending upon the degree of the leak, disc prolapses are classified into 4 different forms. When the leak is contained within the disc, it is called a disc bulge. When it extends slightly out of the disc, it is called a disc protrusion. When it comes out a bit more, then it is called a disc extrusion. When part of the disc separates out from the original disc, then it is called a sequestration. When the disc material starts to leak, there are 3 possible outcomes. The first outcome is back pain only. This happens because the disc itself becomes painful. There may be leg pain, which usually is one-sided, commonly called as sciatica. This happens because the disc material irritates the adjacent nerves. So this disc basically is irritating the nerve which is exiting through the foramen. The third possibility is pain and numbness in both the legs, with or without back pain. This happens when the disc actually comes out and sits in the spinal column, and it basically compresses more number of nerves which are going into your legs. These patients will complain of pain, and also numbness in the legs. There may or may not be back pain. A disc prolapse does not necessarily cause pain all the times. A large proportion of patients may have disc prolapses or bulges without any pain in the back or in the leg. You should seek medical help if the pain has been bothering you for more than 6 weeks, that's about 1.5 months. If the pain is severe, if it is not improving with simple painkillers, and it is worsening. If the pain is associated with numbness and leg weakness also, you should seek medical help. You can be a pain management specialist, a neurologist, a spine surgeon, orthopedic surgeon, or a neurosurgeon. Each of these physicians and surgeons have different roles depending upon the degree of the disc prolapse and the symptoms which are attributed to the disc prolapse. You need to take expert opinion on an urgent basis if you have numbness in and around your groin area, the buttocks, and the perianal area. If you are losing control of your bowel and your bladder movements, or if you have met with an accident, or if you have got high-grade fever and weight loss of recent onset, especially when it is associated with severe back pain. Traditionally, it was thought that bed rest usually is good for back pain and also leg pains, but recent evidence suggests that whenever you take bed rest, it actually deconditions your muscles. When your muscles are deconditioned, then it delays the recovery process. As a general rule, you should avoid movements which cause a lot of pain, such as bending forwards or sideways. And in effect, you should avoid any movement which gives you significant pain. Some amount of discomfort you should be able to tolerate, But if it's too uncomfortable or if it's too painful, then you should avoid that movement. But you should not take bed rest. You should continue to do your normal activities and, if possible, gentle supervised exercises. Not all disc prolapses cause major problems, and not all disc prolapses need surgery. Usually, the rule of the thumb is you use treatments which have the highest benefit and lowest risks. Okay, so you always use a step ladder approach. When you initially develop symptoms of disc prolapse, then the best way to beat it is basically to take supervised medication and also supervised physiotherapy. If this doesn't work, then you move up the ladder and you can try epidural injections. Okay, these are called transforaminal epidural injections. What they do is basically some medicines are injected around the nerve roots with X-ray guidance, and it reduces the irritation of the nerve and it helps in the recovery process. Surgery is indicated when all these fail, or if your pain is worsening, or if you are developing weakness in your legs or in and around your buttock areas. Most of the cases of disc prolapse improve over the next 2 to 3 months of the onset of symptoms. Most cases respond to exercise, medication, and in certain cases, targeted injections. Surgery is associated with its own set of problems, and choose surgery when the benefits of surgery outweighs the risks. There are always options which give you maximum benefit with low risk, and these are the techniques that you should basically seek for. Surgery is last stage, okay, unless you have these red flags that I've talked about.